Alright, so you're gonna open the package. You know the package has this bag in it and a lot of instructions. We just throw it on the side. See, this is the injection here. It has 1.5 cc of calcium hydroxyapatite. That's the active ingredient that we're gonna mix today and hyperdilute. So put this on the side. We have two 10 ml syringes here. Gonna open the first one because we're gonna use that to mix. Okay, because after you add the 4.5 ml of the saline and the lidocaine, you will not be able to mix it in the same syringe. So I take an 18 gauge needle here, use a lidocaine. I'm sorry, we use the alcohol swab to clean the top in here, the rubber stopper. Put this on the side. I'm gonna attach that to my 10 ml syringe. All right, and then we're gonna pull 2 cc's of the lidocaine. This is a 2% lidocaine without epinephrine. That's exactly 2 cc's. Okay, and then we're gonna draw 2.5 with a total of 4.5. There you go. That's a 4.5. Okay, and then I'm gonna take off this needle and attach this adapter. This adapter helped me to mix the products. So here you go. Put that adapter in. Take that out. Okay, to make sure. Actually, I'm gonna do it the other way around so we avoid bubbling. So I push a little bit of the product up. You're gonna make sure to top it off like this so you don't have any bubbles. And the same thing here. Make sure that you have the drip. Here you go. And then make sure to secure it. Okay, and push the product in. Here you go. All right, you see it's a milky appearance. You take that off, the original one, and then you put your other 10 ml syringe and you start mixing. So start by pushing until you get a nice mixture. You're gonna need to do that at least 20 times. Don't do it so fast, don't do it so slow because you're gonna mess with the consistency. And the more you do it, the more bubbling, so you gotta be careful. I still see clumps in here, so that means it's not mixed yet. You can see. Some people, they do it quickly and they end up with a lot of bubbles. We don't want that. So the less the bubbles, we hate bubbles in our work. It just makes our life miserable when we do a procedure. So I'm gonna keep mixing until I get a nice consistency. Okay folks, so after mixing the product here, you see how nicely mixed, milky color, and no clumps. That's how you want it. So I get a total of 6 ml of the product. What I like to do is to distribute that amount into 6 1 ml needles and then cap it. So this is how I'm gonna do it. So take the syringe here, just push it to the top. Make sure that you get some out because you don't want bubbles. Then attach the 1 ml syringe and then push 1 ml. So this is 1 ml. And then I'm gonna cap it and I'll use it. They'll do this for the same ones. Here I have 6 of those. Same thing. receive some pressure, that's normal, but then you have to just fill it like this. All right, so I'll see you in the next part of the video.